Hi guys, I'm Camellia, an APRN, a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And I wanted to get on here today for our Thursday talk to talk a little bit about something that's near and dear to me, personally and professionally, and that is self-care. You guys have seen so many things floating around social media, and you know, everyone's talking about self-care and why it's important. So it can become, and probably has become to some, a little bit redundant, maybe even cliche, but also to some it may feel unrealistic. As a person who has worked in the helping profession of nursing for the last 14 years, I have really kind of strived to commit to maintaining my self-care. Really, focused on that. I've been really focused on that within the last 2 years. And so for me, that's looked like exercise. It's looked like, paying attention to what I'm putting into my body. It's meant for me spiritual connection and enhancing that, and really taking time to refocus, reset, and recharge. And I was doing really well with that, but I will be transparent, and I wanted to share a personal story with you guys. But from a personal professional standpoint, as a psychiatric mental health nurse practitioner, I work at a wellness clinic. We live and breathe with our patients self-care. We talk about the benefits of that from a spirit, mind, and body perspective, and why it's so important. So I also, as a provider, I speak to my patients about self-care and why it's important, but it's also something that I, again, have been able to stick to because I know the benefits of it, and for me and my life. But from a personal standpoint, I wanted to share a story, and this is titled Self-Care and a Testimony because, this story has turned out well, with a positive outcome thus far. But back at the beginning of this year, I was offset by some pretty significant stressors life-wise. And for me, again, I've been maintaining my self-care, doing the things that I needed to do to take care of me. But one thing that happened at the beginning of this year is that I was so intertwined with the stressors and consumed by them that my self-care fell off. And not only did I feel like I didn't have the time for self-care, but I also felt mentally and physically exhausted to the point that I didn't feel like I could be motivated or have the energy to commit to taking care of me. Um, and so, needless to say, I was, I fell off of doing that. Long story short, ended up with the flu, was diagnosed with the flu in February, late February of this year. And it really put me down to a point that I was not my normal self until about 4 weeks later. During that time frame, I also had presented to the emergency room at least 3 times within a 2-month time frame because of some physical challenges I was having. And most of you know, if you're listening to this and you're a nurse, you know that it really takes a lot for us to go get checked out as nurses. And so that just tells you that me presenting to the emergency room pretty often was significant enough for me to, feel like I needed to get, seen or evaluated. So within that time frame, I also had labs drawn and kind of a real workup. And I learned a few things that my labs were off. They weren't within normal range, some of them. And I'm a person who normally gets labs done at least, every year with my annual well checks. And so everything had been normal up until, February, March of this year. And one of those labs was my hemoglobin A1C. And you guys probably know that a hemoglobin A1C is a marker for diabetes. And that lab that I had drawn for me showed that it was high enough that put me in a pre-diabetic range. And I will tell you that was pretty stifling for me. But one of the things that I was led to understand, and this is where, I say self-care and a testimony, is because I was led to understand that a lot of this was related to me falling off with my self-care. Not only was I having more stressors, but the way that I was managing the stressors and not sticking to my self-care all played a part in me having labs that were out of range. And so ultimately that was affecting my health. And so for me, that stifled me in a good way, to the point that I, really went into overdrive and started committing to taking care of me. And I was also led to kind of understand what was important for me to get back to. That was exercise, that was paying attention and being more mindful with what I was eating and putting into my body, as well as becoming more spiritually connected. And so I've been able to stick with that since then, since those kind of aha moments that I had. Um, but one of the things that has stood out for me is that, you know, now self-care, of course, it felt unrealistic at the beginning of the year because of, time and being consumed with the stressors that were offsetting me. I also didn't have the motivation and energy, but I also didn't connect to the motivation with it. And now in hindsight, I'm able to see that my motivating factor at this point is my health. And so, as a helping profession, sometimes we don't stick with self-care. Sometimes we don't feel like it's realistic. We can't, spend any more time doing anything different. Sometimes we feel guilty about stepping away and doing things for ourselves. But really consider what your motivating factor is in all of that. And so for me, it's now my health. And so that's a reason that I will stick to it. Usually when we can attach meaning to something, we're more likely to stick to it. And so I will say, and I'm happy to say, the testimony in all of this is that my hemoglobin A1C has returned to a normal range, and my other labs have as well. And so I'm committed to sticking to that, sticking to my self-care. I've seen kind of the consequences of not doing so. And so at this point, I'm going to be, really become driven by the motivating factors of maintaining my health and my overall wellness to, really make sure that I stick to self-care. So maybe this resonates with you in some way. Maybe you are a person in a helping profession such as nursing, and you haven't stuck to your self-care. Maybe you don't find it important. Maybe you don't feel like you have time. Maybe you feel guilty about it. But consider what your motivating factor is and why it's important for you to maintain your self-care. And I really just wanted to get on here today to maybe encourage someone. It's that important, guys. It's that important. Sometimes as helping professionals, we don't know what we're missing or we've been depleted of, because we haven't really made it a consistent practice of committing to self-care. And so, nursing is a very rewarding profession, but it can also be demanding physically, emotionally, and mentally. So sometimes we aren't able to give enough or as much as we can to others because we haven't given that to ourselves. So really just consider that. Consider where you are in terms of your own self-care, how that translates for your life, both personally and professionally. And, make a commitment to start today, to really commit to your self-care. I'm hopeful that this video has resonated with someone, has allowed some connection with someone enough for you to be encouraged by it to really make a change and do something for yourself around self-care. Let me hear from you guys. Let me hear your experiences. Maybe you have a positive story to share. I'm all about dialogue, and I really would like to hear from you guys around this topic. Have a great day.